Good morning and happy Monday. We're here with Dr. Roman Nations from Nations Best Family Care. Dr. Nations, thanks for coming back on the show again. You know, I've had a few doctors here on the show, and there's a lot of doctors here in Panama City to choose from, right?
Yeah,
Yeah,
it depends
there
on
is.
the services that you're looking for.
It depends on the services you're looking for. Now, you're a family care.
Family medicine, yeah.
Family
it's
medicine.
a specific specialty that you train for in residency, just like internal medicine and pediatrics. Family medicine is a 3-year residency where you're trained to treat everything from infants and delivering babies all the way up to death and dying and hospice care and everything in between. So,
But and that is a specialty in and of itself.
Yep. Yeah. The misnomer is once upon a time it used to be called a GP or general practitioner.
Yeah.
The problem is that GPs actually only did a year's worth of training after they graduated medical school. And in the first year, you learn a lot, but nowhere near what you can learn over a 3-year period of doing the same kind of high intensity stuff. With taking care of a whole vast array of different.
But you're always
issues.
learning too.
Yeah.
I mean, you're always learning, and that is, I guess, what doctors do, or what's expected.
Yeah.
You have to stay current, not only through, I guess, professional knowledge that you get through publications and things, but dealing with people like me who come in with unique.
Well, there's the state requires you to have what's called CME, or continuing medical education, every year, and each state is a little bit different. Like I think California has 50 hours every 2 years that you have to do, which is essentially a week-long class. Now the trouble is that there's folks that just go to these little conferences to meet that requirement, but all you have to do is show up. There's no test taking, there's no knowledge assessment, there's none of that stuff. A lot of the colleges, the specialty boards are now using what's called a board certification and then recertifying board certification. So all of the younger docs that are now graduating have a cycle. It's either 7 or 10 years usually, that once you certify as board certified, then you have to maintain your certification with extra education every year, and then at the end of a 7 or 10 year period, then you have to retest again to basically prove your knowledge. People that trained years before I did got what they called grandfathered in. So they were board certified once and never had to test again. And those are the folks that we see quite a few patients from those other types of clinics, because you can tell they don't read. They haven't learned like what some of the new standards are. Each cardiology has changed quite a few things just in the last couple of years. Vascular surgery with blood clots and things like that has changed a dramatic amount of things just in the last couple of years. So things are always evolving.
So there's a sweet spot between experience and currency.
Yeah.
I would imagine. I mean, just because you've been around a while doesn't mean you're
not
up
absolutely
to date.
Not. We have quite a few folks that come from outlying areas that come to our clinic. And I ask them, like, how did you get set up in this regimen? And their answer is, well, my doctor set it up this way. I'm like, well, this medicine was invented 40 years ago, and this is what it was originally intended for. We don't use it much anymore because of these side effects. And so let me replace that for you and get you what's now current, and not the latest branded medicine, because there's a lot of other generic medicines that do a much better job that don't cost y'all, an arm and a leg.
That's something I never really understood, was brand name versus generic. Is it the same thing, or?
So there's the pharmaceutical companies will argue that their product is cleaner, meaning that the FDA has certain tolerances, and I can't remember the exact number, but like if Pfizer makes like Viagra's one, but there's a whole bunch of other ones that, each individual, like thyroid medicine is a perfect example. So Synthroid is a branded medicine, and the company that manufactures Synthroid, the branded name, would argue that their tolerance, if you have a 100 microgram pill, that each one of those pills that you get is going to have between 98 and 102 micrograms in it. Now, the generic version of it, which is less expensive, the FDA has looser regulations on how much potency is in each one, and so those pills, if it's listed as 100 micrograms, can have somewhere between 90 and 110 micrograms in each pill. So there's more tolerance for the generics.
Jeez.
That's what the pharmaceutical companies reference.
So if you're buying your meds through the mail, or from Canada, someplace like that, you may not be getting.
Oh no, yeah,
exactly
that's
what you
totally
need.
different. Yeah, if you buy stuff from overseas, the tolerances over there, particularly a lot of companies that come from like India, and these, especially when you talk about male enhancement pills and stuff like that you can buy without a prescription, those kinds of things. The
made out of ground up rhino horn or whatever.
Yeah,
you don't know what's in there, do you?
No, there's a lot less tolerance to it. Sometimes people find a good manufacturer, sometimes they don't. The other thing that happens on the generic market is because it's a generic, you can have literally 10 different manufacturers making the same pill. And depending on which manufacturer wants to undercut the other guy, wherever you're getting your medicines from, like Tyndall or CVS or Walgreens, those kinds of things, they will switch manufacturers to get a better deal on their supplier side because it's still technically a generic. So they're offering the patients what there's been prescribed to them. But we get stuff all the time where they'll change it, and sometimes people will come back and they're allergic to the dye that's in the new pill. Or they're allergic to or have a reaction to whatever other chemical they bind it with. So there's a decent-sized difference between generic and branded, but there's also a major cost factor involved in that too.
There's so much to know when it comes to this stuff, and this is why it's important that we have a doctor that we trust that can explain these things. Because for the layman, did you notice the glazed look on my face?
Yeah.
Anyway, so and we're busy with our lives, so we really depend on you guys. But I want to get more into that and what makes your practice a little different than everybody else's here. And right after the local weather, brought to you by the West Pittman Law Firm, westpittmanlawfirm.com. Welcome back to the show. I'm here with Dr. Roman Nation, and we're talking about your health and your practice too.
Yes, sir.
Now, what's the goal? What are you trying to build with your practice?
So, I mean, my whole goal with how I would like things to evolve is as we grow as a primary care practice is kind of including lots of other services that people utilize a lot. So, what we end up doing right now is we refer a lot of things out for like imaging, for MRIs and CT scans, and we have a lot of feedback both directions on. This company says they can't do it, or the insurance company doesn't accept this company's credentials, so then they won't, and we have to farm things out. And my particular problem with a lot of it is, especially with the hospitals, is that they overcharge everything. I mean, the same study at one of the hospitals is literally 5 to 10 times what it would cost at an outside facility.
Jeez, why is that? I guess they have overhead and all.
It's just the way that their contracts are written and stuff like that, and because it's a 24/7 facility and things like that, they can kind of get away with it. I have some personal heartburn with it, but that's just the way the system is. So, I mean, that's part of it. There's other stuff that we do. There's a lot of things where counseling, psychological counseling plays a huge factor in a lot of what we do when we talk about health and wellness. Our whole thing is about health and wellness, getting people to be as happy and healthy as they can be.
And that whole mind-body thing is real, isn't it?
Yeah, and there's still a lot of stigma with folks trying to go see a counselor. They know there's something bothering them, but they don't want to talk about it, and they've got this preconceived notion, just like in the military, is that if you go and sit down and talk to a counselor, that all of a sudden they're going to label you, big crazy stamp on your forehead, and nothing's going to happen. Those are the kinds of things that we're trying to incorporate those additional services, because it's a lot more disarming for folks to come into my practice and say, okay, well, just sit down and we'll talk for a little bit. I mean, JT, and the other providers.
Your nutritionist, JT.
We all do a fair amount of that as it is, where folks come in and they talk about whatever's stressing them out. Well, that's great. There's some stuff I can do on the medicine side of things, but our appointments are too short to really get to the heart of the issue, and that's where the counselors come in. So that's kind of one of the next arms that we're doing, in addition to the nutrition stuff, which we've used in the last year and had really, really good success with it. Folks getting off of their medications, lots and lots of folks want to do that, where they would much rather eat right and exercise appropriately and cut down on some of their medicines, or especially our middle-aged folks, both men and women, where they're approaching, their blood pressure's going up, or their cholesterol's going up, or their hormone levels are malfunctioning.
Stop talking about me, will you?
No. But that's what we do. We have a lot of folks that want to do, okay, well, I used to be able to eat like this, and now I can't. So that's our whole crux of things, is wrapping all that together in a nice little package, and we all talk to each other about how it's going to get done.
So you guys get together and you talk about the patients, and you're like, so you look at this whole mind, body, nutrition, I mean the whole, from A to Z, which is probably a really good approach, I would think, because I think people want to be more natural nowadays. You're used to going to a doctor and say, hey, fix me, write me a script, and off you go.
Yep.
But there's other ways of dealing with things.
No, anymore it's they come and they're told they've got a diagnosis. I had a couple just last week that said, well, my other doctor told me I was a diabetic. She gave me these pills and she said, eat better. And that was the extent of their education. And so they were referred over to us from another pharmacist. Mullins Pharmacy was really good. And she says, well, I need some better education. I said, I have the perfect program for you. So we set them up to really educate them on not just the fact that you're a diabetic. It's like, how are you going to get control of this without having to take medicine?
So it's not all up to your doctor. It's up to you.
Oh, yeah.
Really, as the patient, to take a little more responsibility for your own health.
Yeah. And we endorse that every day,
Yeah.
as, take responsibility, both with smoking and weight and exercise, all of that stuff.
Dr. Nations, thanks so much for coming on the show. I always learn something with you. And we'll see you next week.
Yes, sir.
And we'll be right back after your Mad Hatter Minute.
Hi, I'm David Lovett, and this is your Mad Hatter Minute. Today, we're going to be talking about oil leaks. There's nothing more annoying than to move your car and see that big, black, grimy oil stain underneath your vehicle where it used to be parked. Oil leaks aren't only embarrassing, they're an indication of a problem and must be taken care of immediately. Gaskets and seals are what keep oil inside the motor. There are dozens of gaskets on the engine. There are gaskets on top of the motor, there are gaskets on bottom of the motor, there are gaskets on the left side, and there are gaskets on the right side, in the front, in the rear. Any one of these gaskets can fail, causing an engine oil leak. Oil leaks can evolve into a very serious repair. Should you not replenish the oil as you lose it, oil will not be available to lubricate the internal moving parts of the engine. Engine failure can occur. Some vehicles have gaskets that protect oil from getting on top of the spark plug. Should oil get on top of the spark plug as you're driving, a misfire condition will occur. Your car will spit and sputter and act like it's going to die while driving down the road. You'll think it's a very serious repair, but it's not. Best advice is to get it into a repair facility and have them check it. Replace the valve cover gasket and the valve cover grommets. The grommets are what separate the engine oil from the spark plugs. Clean the spark plugs and you should be good as new. Best advice, if you have an oil leak, take it to your trusted auto repair facility. Have them identify the oil leak and fix the problem correctly. I am David Lovett, and that has been your Mad Hatter Minute.
Hey folks, this is Joshua Brown with Mad Hatter on 23rd Street. Is your check engine light on? If it is, text MADHAT28, that's MADHAT28, to 24247 and we'll check it for free.
Welcome back to the show. I'm here with Dr. Aaron Shores from Spine and Neuropain Specialists here in Panama City. Welcome to the show.
Thank you.
Or welcome back to the show. There's been a lot in the news lately about depression, and your specialty is pain, basically.
Correct.
And I would think, just as a layman, that pain and depression kind of go hand in hand.
Yeah, they certainly can, especially in the chronic setting. We see, unfortunately, lots of folks in our practice that have chronic pain, and when you hurt all the time, that tends to create a level of depression or anxiety.
Understandably so, too.
Yeah.
I mean, how could you possibly be in a good mood if you have chronic pain?
Correct, and that's very, very tough. And part of the lifestyle, a lot of folks who come to see us want to improve the quality in their life. And that's part of doing it. Not only do we speak to them about injections or medications, but we also have to make sure that we pay attention to the mood component, or the coping mechanisms that some of these patients have, because they've suffered, some of them, for decades, and it takes some time to work through that to improve their quality of life. So the mood is very, very integral part of pain management in our practice.
Yeah. So. You're an MD, of course, and that's your specialty is pain. And you treat the physical part of things and the medical part of things. But how do people get past that mental state of that whole chronic pain business?
Yeah, great question. It varies from patient to patient. Some patients, not everybody needs that explored so much with treatment of their pain. But folks that have had chronic issues with pain, a lot of them, I think it is helpful. Now, unfortunately, not everybody has the insight to do that. Sometimes when we try to broach that discussion with folks, they get offended or feel like we're telling them that their pain is all in their head, which is actually not true at all. But many patients, I think, who are willing to go talk to someone, with some medical training, a psychiatrist or psychologist, I do feel like if they stick with it, with a comprehensive pain management plan, addressing the mood and the anxiety that goes with chronic pain, or understanding that unfortunately some patients we can't completely fix their pain, and there have to be some helping coping mechanisms for those folks going forward, because otherwise I find a lot of patients sometimes get some dysfunctional relationships in their marriage or with their children or other family members because they're always hurting and suffering, and that can put a lot of strain on other relationships.
Yeah, I mean, a person's chronic pain can have second and third order effects and a ripple effect, through your family.
Correct.
And even your community and the people who are probably most important to you.
Yeah, absolutely. And sometimes other family members are, kind of quote, walking on eggshells around you because they're not sure, how the individual is going to react that day, and that starts to lead to some unhealthy codependencies and negative relationship interactions that can be very detrimental on someone's quality of life and their relationships, and can even become a self-fulfilling prophecy where these things just start to happen over and over. So I think part of adding quality back to someone's life is not only addressing the physical therapy and the medications and the injections that sometimes go with managing someone's pain, but also getting them to an expert or a specialist who's used to dealing with these issues. Because sometimes I think folks think, well, I've already taken an antidepressant, that's all I need, and oftentimes that's not what folks need. We're in a society where we want something fixed quickly, and we sometimes feel like a pill will do that, but it doesn't address the underlying mechanics and sometimes negative emotions and thought processes that go with these feelings of depression and anxiety, and that's where working with a therapist or a trained professional can sometimes add tremendous benefit to someone's life.
You touched on it earlier, but do you find that some people may be resistant to those type of therapies? I mean, if you're in chronic pain and you're feeling depressed about it, and you make a referral, they're like, hey, whoa, wait a minute, doc, just fix me and give me a pill and I'll be on my way.
Yeah, I do, and I find men in particular, as a general rule, tend to be a little bit more resistant to it maybe than women as a general rule. And I suspect part of that may be societal. Men are, feel like we have to be tough and we just need a quick fix, and sometimes, but that's not just exclusive to men, that's anyone. But yes, there are patients that are resistant to it. Sometimes still in our society today, there's a little bit of a stigma that sometimes people believe that come with seeing a psychiatrist or a psychologist or working with a therapist that implies that they're either crazy or weak or less of a person. And unfortunately, that's just not true. And folks that are willing to take that leap of faith or take that one step forward, which is oftentimes the hardest thing, I think end up having a much better quality of life than folks who continue to resist it.
So treat your pain and don't be resistant to treating other things that may affect your happiness.
Absolutely.
Dr. Aaron Shores, thanks so much for those words of wisdom, and we'll be right back after these messages. Welcome back to the show. I'm here in the studio with clinical counselor and author Thomas Winterman. Thomas, of course, is the author of The Thrive Life. Can you get that? All right, here we go, The Thrive Life. And Thomas, you've been coming on the show now for about a month or so and giving us Thrive Thoughts for the week. And for people who don't know you, you've gone through your own transformation of sorts, and you turned your life around.
Yes.
From being a pretty boring guy to the exciting person that we see here in the studio today.
That's right.
Yeah, I mean, you lost a lot of weight. You went back to school. You did all the things you thought you should have done, and now you're in your happy place.
That's right.
Yeah. Now, what's a good Thrive thought that we can take with us through this week?
For this week, it'll be fake it till you make it.
Fake it till you make it.
Yeah.
That sounds disingenuous.
A little bit, but in therapy circles, we don't call it that. We call it acting as if. A lot of people have goals to be happier in their jobs, to have a better life at home with their family. And what people don't realize is that if you start to think about what your life would be like if you achieved those goals, how would you act at work if you were happier? Something as small, how would you walk? How would you talk? What kind of language would you use? You start acting as if. You pretend like you've already achieved that goal and you're already happier at work. Remember, your actions, thoughts, feelings, and physiology are all connected. So by doing this, you're changing your actions, and slowly but surely your thoughts and your feelings will come around, and eventually you're not pretending anymore. Suddenly you are happier at work because you've been intentional and you've changed your actions.
It almost sounds metaphysical. When you're like, hey, I'm going to embrace my success. Even though I may not be successful, I'm going to be like, hey, I'm going to act like a successful guy.
Yes.
And there's a lot of old sayings that people say, oh, money goes to money and things like that. But it's kind of true in a way, isn't it?
It is.
That you get out of people what you expect from them, and you get out of life what you expect from it, don't you? Ultimately, it's up to you.
That's right. And you can
or you, or whomever. I dropped my glasses. Okay.
And you can create positive momentum for yourself just by doing small things, forcing yourself to smile. Something like that can slowly change your thoughts and your emotions, and those things can snowball. And eventually, you find yourself being a happier person.
So it doesn't have to be a forced smile, but
That's right.
whip one out when you can.
That's right, yeah.
Doesn't cost you anything. Uses less muscles, too, I've heard.
Yeah.
Thomas Winterman, thank you for that Thrive Thought for the week. And remember, fake it till you make it. We'll see you next time.